Brian Grisham.
Criminal penalties, I don't like as a non-jurist. Micromanaging what those penalties should be. I take my lead on that from district attorneys and from judges and from the state bar. But I will say this. Jessica's law was long overdue, but it was not the first time it was passed. It was passed in the House last time as well. It was held up in the Senate, as I understand, by a Democrat. And I disagreed with her on that. I think it was a huge mistake. I believe it was Senator Kate Brown. That was a mistake, but that was not any one person's doing. And Kevin says he doesn't take credit for it, but he went on Bill O'Reilly to take credit for it and did. But I agree that taking credit is one of the problems, getting back to the partisan issue, that you're having. Too many people who want to move up to higher office and do these things is why you move slower on them. Let's talk about what we need to do in law enforcement. We had the chance to support our state police, which would help us with meth, with all kinds of issues, and there was a vote that cut 20 state troopers. My opponent voted for that. Now, we can make a choice if we want basketball games in Portland or state troopers, but criminal penalties are nothing if we cannot even get the criminals into jail and we cannot capture them. We need to work on that. We need to support our public safety community better, and we can do it. Thank you.
What steps would you suggest to improve affordability of health care and to increase the number of insured Oregonians? Brian Grisham?
Very excellent question. And I will tell you that this, not education, first-class education, is the issue that people are most concerned about. I grew up in the education system in Salem, and I have daughters in it now, as did Kevin. It is a first-class education, and we can talk about that more, but it is already. What we need to focus on is the less than first-class health care that we have. We need to do three things. We need to expand the insurance pools so that more people can be covered by insurance and not be on the Oregon Health Plan, but also reduce those costs so they can use that money to go and live their lives and pay for things like getting to and from work and being able to support themselves. We need to expand bulk purchasing of drugs. This is a no-brainer. This will save us millions of dollars if we can do this. The only people who oppose it are the pharmaceutical companies. And look at the legislators who are supported by them. That's one of the reasons it's been held up as long as it has. Third, let's talk about the Oregon Health Plan. An excellent idea, but it needs to have prevention built into it. Instead of just paying after someone gets to the end and needs an expensive procedure, let's put in the requirement for clinical visits. Let's put in a requirement for more ownership of your personal health care. That's not discriminatory. That's not too much to ask. That's something that's reasonable and can save money on future costs. And that's a smart way to go.
Kevin Cameron.
Well, we have the best health care in the world in America. And I think that that's something that we could be proud of. Now, we have some problems with it becoming so expensive and hard to get, and that's an issue to Oregonians. And I think that it's such a complicated problem. There are so many reasons for it. To answer it here in the time we have, if we could do that, it would be great because we'd have a magic wand and we could go and fix it. But I think there are some practical, common sense things that we could do. First thing is tort reform, to balance the issue of personal responsibility and doctors and patient rights. The second thing would be to encourage more portability with health savings accounts and encouraging people to take responsibility for their health care decisions and having to write out a check, even in the Oregon Health Plan, to actually have so many funds I have to spend. Another thing would be to move in our higher education system to help provide more opportunities for the providers, for the education of the providers, for nurses, for physicians' assistants, and if we can provide more providers, anything, we all know that if we have a system of more availability, it'll help reduce the cost. And so I think those are three things real easy that would be simple, that would help us with our healthcare cost.
Next question, and this will be the last question. Do you support any changes to the basic tax structure of the state? Kevin Cameron.
Well, I do support one major change to the tax structure, and that is a rainy day fund. We need to set money aside for our future. As long as we have an income tax based revenue generating system, then just like if I was a salesperson and had seasonal trends in my business, I need to set aside money and know what I'm going to spend down the road. And so we have a real opportunity right now during this huge incline in revenues that we're seeing from a good economy to set some of that money aside and only put gates around it that it could be touched if there was an economic downturn. And there's a lot of people that need to come to the table and make that happen. I think the corporate kicker is one area that we could discuss, and I've heard from businesses that they'd be willing to come to the table and talk about how that money could be used for grants and scholarships for higher education that would actually be investment in our infrastructure and things that happen in our state that businesses would benefit from, employment would benefit from. So I think there's some willingness to sit there and talk about those types of things. But the main thing is a savings for the future. None of us can run our own personal lives or our business without having some availability to set aside money for when there's a little bit of a storm. And I think that would be the simplest thing for us to do. There was legislation on the House last time. It couldn't get anywhere. And again, we need people that will come together and make that happen.
Brian Grisham.
Well, thank you. And you know, this is the thing. There was legislation that didn't get passed. We need new folks in office. A rainy day fund is something that I've been calling for years. Kevin and I agree on this. And it not only, and this is, by the way, a non-education rainy day fund. It was mentioned before at a previous forum we had that we need an education rainy day fund. We have one. What we need is a non-education rainy day fund. And that's great that corporations want to talk about the kicker. But one other thing that corporations have talked to me about that they don't mind is talking about raising this ridiculous $10 minimum corporate tax. Look, Kevin and I will both agree that he has had years to build up his business, so his business is bigger than mine. I'm a consultant, and I'm working on mine, and it's going to be big later after I do my sacrifice here in public office. I can afford to pay $10. Therefore, so can Kevin, and so can every other company in this state. If I can do it, they can do it. We should raise that. I do not support an increase in the income tax this time, and I don't obviously support messing with property taxes right now, but I'll tell you something about property taxes. We have a tax expenditure report that has more breaks in it and accounts for more money than we collect in property taxes. If we went in and cut just 50% out of that, we could start realizing far more revenue out of the taxes we already have. So those are things we can do, and those are things that I think can move us a little bit forward. But in the small term, I must just say, before we start messing with taxes too much, we need to show accountability, we need to show those audits, and we need to get the trust back from the citizens of my district anyway, before I can go and ask them for that.